Okay, well, this time what we want to do is talk a little bit about dental implants and the precision necessary for success. I'm sure you've heard ads on a radio about discount implants, and we have actually done some marketing similar to the jokes you've seen before, where there's a barber shop and right next door is a cheap barber shop, and the sign in one place says, "We fix $5 haircuts." In essence, that's what we do in my office is we fix discount dental implants. The reason why that's important to understand is that a picture is getting painted that implants can be simple, implants can be quick and easy. And really, the more implants a dentist does or a surgeon does, the more they realize there's no such thing as a simple implant. So the reason for that is that precision is so vital to success. What we need are certain parameters that we have to work with. We need adequate bone for an implant to be placed. We need a thick enough bone that will allow a blood supply to nourish the new bone and the replacement bone as time goes on, and the soft tissues, the gum tissues that support the crowns and the teeth. Without the respecting these specific numbers, implants will fail. They will fall out. We will get gum recession, so maybe the implants won't fall out, but they will be an aesthetic nightmare or a hygiene nightmare because the plaque and debris will accumulate. So the way that we do it in our office to ensure absolute success is, number one, we start with a cone beam x-ray. What that means is it's a three-dimensional x-ray of the bone, the jaws, and the teeth to find out where the bone is and if we need to do an augmentive surgery. That means that's a fancy way of just saying a bone graft or adding bone, growing bone to give us the adequate thickness. Once we also know where the bone is, we can use the same information to plan out the size of the implant that we want to use, the depth of the implant that we want to use, and the correct angle of the implant. Quite often, implants that are done blind, where the dentist just extracts a tooth and places an implant right down where it came from, there's no knowledge of the bony architecture. There's no knowledge of where things are. And sometimes it's better to be lucky than good. There are cases out there, in fact, I've done them myself, where I have extracted a tooth and placed an implant. Everything seems to be fine going on, several years later, but I think honestly that was more due to luck and not skill. So we use guided software. We use a software system that allows me to design the case, look at it three-dimensionally, planning exactly the depth, the width, the height, everything about an implant, so that when I place the implant, I know exactly where it's going to go. Even with that, though, I always go back and I measure and I take an x-ray and ensure that we have it exactly where we need to be, because sometimes we need to add a graft. Even if we've done a graft before, we sometimes have to graft again to make sure that we have enough bone. So precision is paramount when doing dental implants.
Dr. Timmerman is known internationally with licenses in multiple states in the United States, plus Belgium and Dubai, for cosmetic, implant, and sleep dentistry, with fellowships in the International Congress for Oral Implantology and the Academy of General Dentistry, and a diplomate in the American Board of Dental Sleep Medicine. If you would like to become a patient of Dr. Timmerman or simply have questions, please go to our website, www.drtimmerman.com. That is www.drtimmerman.com. Or call us at 206-241-5533. Or you could email questions for an episode of a future podcast at thewholetoothpodcast@gmail.com.